Thank you, Harsh. Good morning, friends. So I would be talking to you on what new is coming in medical management of glaucoma. You have heard all the eminent speakers, and Dr. Harsh said that you just use two bottles and it's a maximum medical therapy is done because you can use 4 drugs. So is it enough, or do we have something else as well? Let us see. When we have to treat the glaucoma, what we have in our armamentarium, the medical, the lasers, the surgery, and obviously all of us knows that the medical management is the mainstay in most form of glaucoma. The history of medical management is pretty old. It's a almost 150 years old history of medical management when first the Iserine drop was introduced. But the most exciting molecule was the beta blocker, which was introduced in 1971. Following the beta blocker, another most exciting thing happened in medical management of glaucoma was in 1996 when PG analog was introduced. And then after that, there was a big pause of almost 21 years, and we did not have any other medication. Some drugs were keep on coming with a different concentration, with a different form, like the latanoprost to travoprost to bimatoprost, and then different concentration of bimatoprost. Similarly, the alphagan in different concentration, the brimonidine in different concentration, so on and so forth. But now we have some more exciting molecules are coming into the market, and one is initially it was named as a Vasnio, but now the company has changed the name and has launched the molecule in the name of Vysulta. It's commercially available in most of the Western world. The second exciting molecule is the Ropresa, and in the same class, in the same category, the Glenatec is available for quite some time in Japanese market. Like the Unoproston was first introduced, the first PG analog was introduced in the Japanese market. Similarly, this Rho kinase inhibitor was first introduced in the Japanese market with the name of Glenatec, and now recently the Ropresa, the Rho kinase inhibitor, is approved and it's commercially available in the United States and some Western country. And another very exciting molecule is likely to hit the market is Roclatan. Dr. Harsh was telling that we have the first beta blocker free combination, fixed combination drug available. That is the brimonidine and brinzolamide. It is going to be another fixed combination drug free of beta blocker. So if we talk of the new drugs in the horizon, then what it could be? It can be the new molecules, it could be the new combination, and it could be the new drug delivery system. Dr. Vinay was talking about the compliance and adherence. Probably that may add to the compliance and adherence, the new drug delivery system. I was just talking to you about the Vysulta. Some of my patients are using this Vysulta. It is a newer prostaglandin analog, that is a latanoprostene binod. Comes in a concentration of 0.024. It is like a PG analog, but the special thing about this molecule is that it is a nitric oxide donating PG analog. The nitric oxide helps in relaxing the trabecular meshwork. So in fact, it enhances the aqueous outflow in a more physiological manner as compared to any other PG analog, which enhances the aqueous aggression through the UV scleral outflow. So it enhances the aqueous aggression through the trabecular meshwork itself. And this nitric oxide is a vasodilator as well. So you may say that apart from the IOP lowering efficacy, it may be a vasoprotective as well. But it's all theoretical, but the fact remains that it has a good IOP lowering efficacy. It is through the trabecular meshwork, through the physiological way of aqueous egression, and it can reduce the intraocular pressure from 7.5 to 9 millimeter of mercury. It's given as a once a day like other prostaglandin analog. So it's a very exciting molecule, likely to be available in India soon. It costs somewhere around $200 in the United States for 2.5 ml bottle. The next is the netarsudil 0.02%. It's a ROCK inhibitor. It comes with the brand name of Ropressa. It was introduced in the market by the company called RE Pharma. The Vysulta was introduced by the Bausch & Lomb, and this is by the RE Pharma. It's available. Many of my patients are using this Ropressa. It's again an exciting molecule. It again acts through the same mechanism. It enhances the egression of the aqueous through the physiological channel, that is a trabecular meshwork, with a little different mechanism. It inhibits the enzyme Rho kinase present throughout the body and concentrated along the trabecular meshwork also. Once it inhibits the Rho kinase enzyme, then there is a relaxation of the trabecular meshwork, and it enhances the aqueous egression through this, and it has a capability of reducing the intraocular pressure up to 5 to 6 millimeter of mercury. So both these molecules, the latanoprostene bunate and the netarsudil, acts through more physiological way, and both are capable of reducing the intraocular pressure varying between 5 to 9 millimeter. Netarsudil has a less efficacy as compared to latanoprostene bunate, but again, it is also given as a once a day. So when a fixed combination of these two drugs will be available, you don't have to compromise the ideal frequency of any of the medication, and that will be the only fixed drug combination available in the market, which I'm going to take up in a few minutes. Another molecule which is available for quite some time in the Japanese market, maybe for almost 3 to 4 years, it's of the same category, the Ripasudil. It's available in 0.4% concentration. So this again acts through the same mechanism, but its efficacy is less, as all of us have seen the uniproston, which has much less efficacy as compared to other prostaglandin analog. Similarly, this Ripasudil has much less efficacy as compared to the netarsudil. It has to be used twice a day, and both the netarsudil and Ripasudil has a specific characters as well. They are cornea clearing agent. Again, it is under trial, but yes, in the Fuchs dystrophy, that clears the cornea becomes clear. So again, its role is evaluated, and if it's the fact, then again it will be having a dual action as well. So the Rho kinase inhibitor again has some side effect. It also causes hyperemia almost in 30% of our patient, causes lots of burning and irritation in the initial few days. And if you add on with some other medication, then IOP lowering efficacy goes down significantly. It reduces the intraocular pressure by around 2 to 4 millimeter of mercury. And obviously it's a cornea clearing agent, but on clinical examination, it causes a gutted-like changes in the cornea. If you see a patient with the gutted changes and on the netarsudil or Ripasudil, then don't confuse with the Fuchs cyclitis. So the newer combination which I was telling about you is a Rocklatan, which is not yet US FDA approved. It's likely to get US FDA approval sometime in the month of March this year. It's a combination of Xeloton and the Ropressa, and it is considered to be the most potent anti-glaucoma drug will be available on this planet as on today. So as I said that Rocklatan is a combination of Ropressa and Xeloton, and it reduces the intraocular pressure very significantly. Almost 56% of the patient recruited in this study with the pressure more than 30 millimeter of mercury, almost 56% of the patient, they showed the reduction in the IOP, and which has gone down to 16 millimeter of mercury. Another thing is the sustained release PG analog, which is available as a punctal plug, ring insert, intravitreal implant, and the bimetoprast insert was tried, was approved by the US FDA. It remains in the puncti for up to the 6 months. Its efficacy lasts for the 6 months. Has not become very popular because it causes lots of foreign body sensation, lots of hyperemia, lots of lipolysis, and the patient come to you with a deep sunken eyes with lots of periorbital pigmentation. So in summary, the Ropresa, Vyzulta are the new IOP lowering agent approved by the US FDA recently. The Roclatan is likely to be approved by the US FDA very soon, and it is going to be the most effective anti-glaucoma drug. Thank you for your patience hearing.